Well, more holiday gatherings are right around the corner and in all of the middle of a season with respiratory viruses. When it comes to kids and illnesses, how do you know if they're still contagious and it's safe to bring them to large get-togethers? Well, here now to give us some of those answers, Dr. Vinitha Moopen from WellSpan Family and Pediatric Medicine. Thanks so much for joining us this morning. Okay, so Dr. Moopen, where in that many medical professionals are calling that triple-demic, RSV, flu, COVID-19 cases popping up all over the place. What are you seeing when we're talking about kids?
Right now, thankfully, we're seeing a decrease in the RSV spike, but unfortunately, we are seeing an increase in influenza A at this point, and we do still have quite a few COVID cases as well. So right now, the majority of cases are influenza and COVID.
And we're talking about right now, a lot of people are going to be getting together with family members. If they see their kids pop up with some sort of sickness, how do you know if they're in the clear, maybe they're on the mend? How do you know if you should bring them around other family members? In some cases, kids or elderly individuals.
Right. So at this point, the rate that we have the infections, if you are or if the children are symptomatic, I would just stay home. It's just not worth it to get to the point where we're talking about increasing symptoms or hospitalizations and things like that. So if there are symptoms, just stay home, especially if you're going to see someone who is younger or has immunocompromised issues like in older people.
Well, let's talk about on the other side. Maybe you have a young one and you want to bring them to a family gathering. There's going to be a lot of people there. What are some of the factors you should consider to keep you and your family safe if you want to go to these gatherings?
I honestly would just keep them home if they're really young, like especially these 6 weeks and under. I would stay home. Older than that, if there are symptoms, I would ask the people if they could to mask, definitely washing hands and all of that we do for viral infections. But just be on the safer side, just because we have such a high number of infections right now.
Use that parental instinct, right? Don't feel bad about asking family members to mask up, wash the hands. You got to be careful, be safe.
Right, exactly.
All right, so how do you know if a child should be seen by a doctor if they want to come see WellSpan Health? How do you know, what's that deciding factor?
So if there's a very high fever, if you have signs of respiratory distress, rapid breathing, things like that, or if they're not, if they have some issues with their hydration, so they're not passing urine as often, they're not drinking as much, then they need to be seen as soon as possible. So I would make an appointment, err on the side of caution, and see your physician as soon as possible.
Yeah, you might have mentioned it, but what's that threshold? What's that temperature? A lot of people are worried, is it too high? Is it not? When do you make that call?
So a fever is anything above 100.4 degrees Fahrenheit. Okay. So anything above that, especially if it's lasting more than 3 to 4 days, then they need to be seen.
Dr. Moopen, thank you so much. I know a lot of parents are worried. Myself, we were just dealing with a sick little one last week, so it definitely is going around. All right, we have more information on how to make an appointment on our website, fox43.com. Dr. Moopen, thanks again for joining us.
Absolutely.